But it is the truth that the private sector is attending to more than 40% of the patient load in Tanzania. So that means if you put away the private sector, 40% of the people will miss medical care. And the 40% of the people, that is a lot.
We think the private health center is important because if you ask the patients, I think they agree with us that the services are faster. Probably there is more privacy in the provision of those services. And this is a very important element, I think, in the whole aspect. The challenge is the staffing. The clinics here, the government has opened up clinics everywhere, particularly in the rural areas, these primary care clinics. And apparently they have not improved the staffing training to cover for all these extra clinics.
There's more than 20,000 people. And the whole of Majengo, there is no facility with an X-ray, there's no facility with an ultrasound machine, there's no facility with a modern laboratory.
When we were starting, there was no files for staffs, there was no contacts, there was no room for dispensing, so we had dispensing at the reception. It was taking about more than half an hour just to trace the registration card number or to trace a file of the patient. So we have tried to put a system in such a way our clients or our patients won't spend a lot of time at the clinic. We have tried to separate the administration from the clinical services you are selling, so that when there is any administration issues, somebody else will be dealing with that. Not only that, but we were operating only from 9 a.m. up to 3 p.m. So we are looking forward to start operating for 24 hours. Also, we have also sent our request asking for the Ministry of Health to come and visit us so that they can start simultaneously the vaccination, so that we can start the health clinic right here. Because all around here there is no clinic for vaccination.
We are running a diabetes clinic, which is being supervised by APHFTA. So we've been going with that program for a long time.
We started with a few people attending, and then patients have been increasing. So that shows that our services are appreciated by the people. And then we had a lot of malaria cases when we started, but as the years go by, there's been a fall of malaria prevalence in the area. We used to attend up to even 20 patients of malaria a day. But nowadays, we can get 3, 4 a day. There was also a low birth rate to the people around here, meaning that they are using the information to give them the services of contraception we are giving them.
The parents are quite educated now, the population we're catering for in the town. If you give them the oral hydration circuits and they start feeding instantly, you don't need to sit them down again and rehydrate them in the form of sort of extract or anything like that. self-instructed.
Don't want to use condoms. So most of us, when the mother come, we just I ask them, the mister to come, husband to come, so that I have a special thing to talk about family. Then I talk with the father individual, then I come to them together. Then they agree. Yeah. Because the mother, if his wife go and talk about condom in the house, they don't accept. Yeah.
Well, we provide outpatient health care, and also we do provide health education on to certain primary schools, and sometimes to local people. We arrange with the local leaders, local government leaders. So we provide once or twice a month health education on some diseases like diabetes, how to prevent malaria, and likewise. We also give laboratory services, and very rarely reproductive care, especially to what we call contraceptive care.
The first collaboration I should really say is that even the government now has laid out a regulation. For the public health facility, they always have a board. But in that board, there should be a person coming from a private dispensary sector, people from the government sector. They are always with us. For example, they always conduct a quality assessment in our laboratory. From the public sector, they come over here, you visit our laboratory, try to perform this quality check.
Because people have been told very often that we are for profit. So they have a negative look at these private health facilities. It's only of recent that after APHFTA started pushing hard, it's now that people are starting to understand that we are not for profit.
So the association is very much important for us. Through APHFTA, at least we get some donors. For example, as I told you, we established this specialized clinic, the diabetes clinic over here. We got the donors through APHFTA.
Because through APHFTA, we're getting a number of words from them of improving our centers. Yeah, they managed to give us loan. I think there's a loan which the initiator is APHFTA.
There is like a stigma. Most of the patients, they don't want to deliver in government hospitals. Sometimes they feel that it is like stigma, I think. If they come to us, then we process the procedure and give the drugs as fees. Then we refer again. Sometimes every morning, if we have more than 4 mothers, we sit with them as a group and we teach them, and then we do counseling individual.
Also, there is a confidentiality which is being taken there. And in our case, that room is being marked as a diabetic clinic. So, if somebody enters there, nobody knows that he is entering that's HIV and testing area. So,
because who benefits at the end is the patient. It's not me, the patient. The same citizen of the same country.